Now, as we look at the stay-at-home order, we're also looking at the closure of schools in Toronto as all the kids are looking to remote learning, and also changing up the rollout, prioritizing certain people within our population. So let's join Mayor John Tory right now for his weekly check-in. We're going to talk about all of it. It's the first time we're talking screen to screen. I'm at home. Good morning, Mayor. How are you?
Good morning. Fine, thanks, Mel. How are you?
I'm okay. All right. I'd like to begin here with your reaction to the province. And as you might have heard in our sound off segment earlier on, I think frustration is there. Frustration has always been there, but extra anxiety for a lot of business owners, a lot of residents saying, how do we do this again? So let's begin with your reaction to the stay-at-home order and whether or not you feel this is the right move right now.
Well, I think the Premier brought forward a solid package of things that had to be done in response to the escalating variant problem that we have. I mean, you just can't look at the numbers in the ICUs, the hospitalizations, the people who are continuing to be affected by this and not take additional action. And so I had said I was open to it as, a week ago, and I was happy that he responded and took careful consideration of what the right thing to do was. And I think in so doing, they eliminated some of the unfairnesses that existed between big box and smaller stores. And I think in turn, what's more important is not the unfairness, that was unfair, but that it's going to be more effective because the big box stores, for example, won't be as much of a magnet for people, which was part of the problem. When you have a magnet for people like that in big box stores, and it's all tragic and it's all unfortunate, big or small, restaurants or not, it's all tragic. And it is frustrating. I understand that. But at the same time, these things are necessary. They've been done everywhere in the world. When they're done more effectively, they work better, and then they can be taken off and you can be back to something that is approaching a more normal life, although that's been few and far between places because of the variants. So I think it was a solid package, and I think that now the key is going to be, when you have Steph showing her traffic cameras tomorrow morning, is there less traffic than today? And then next Monday, is there less traffic still again, so that people get the message that they really should decide, as you have done, that they should stay home if they possibly can to do their work, and that they should limit their shopping to, once a week instead of 3 times a week, and that they should not just take that extra trip out here or there, depending on what they're doing.
Of course, the other big piece of this puzzle here is vaccination. So just got the latest updates. So to date, over 665,000 vaccine doses have been administered in Toronto. That's a positive. But there are still a lot of appointments that remain available. We do want to encourage people to get those vaccines. What's going to be important is getting those high priority, high risk neighborhoods where we are seeing a big concentration of COVID-19 cases and getting those doses to them. So do you know what those intricacies look like, those details, as the Premier announced yesterday what this rollout's going to look like? How is this all going to happen?
Well, first of all, people should not assume, and I know we've been focused on our own clinics and talking about how many people come there and how many appointments are available and so on. Today in Toronto, just as an example, we have 38 different clinics. So we're already at the task with the hospitals doing a lot of the work on this, of going into the community with mobile clinics and so on. Now we've got to ramp that up using some of the resources that we might redeploy from the clinics and so on, and get at those hotspot neighborhoods by postal code. And we know the postal codes, we know how much supply we have, and it's not unlimited. And we have registered nurses and others, RPNs, that can do this job, immunizers. So I think it's going to take just a little bit of time to get it ramped up, but then we can go right into those neighborhoods. And then it's going to rely on the same thing that we've had to rely on with regard to the clinics, which is people actually deciding they're going to sign up when we show up. And we've got people out in the community kind of going around, literally knocking on doors to say, come on out and get your vaccine in these high-risk neighborhoods. And I think that is hopefully going to allow us to really attack this problem where it's at its most intense, which is in those high-risk neighborhoods that also are residents for a lot of essential workers, so that we have a 2-for-1 kind of accomplishment there. We get into those high-risk neighborhoods and reach a lot of essential workers at the same time. So I think that it's going to be helpful, and that's what allowed the Premier, I think, to set a goal as well, of saying that we're going to have 40% of people immunized by the end of the shutdown, which I think is good to have that goal, and I think it's one that we can achieve. In Toronto, we've now, as you said, achieved well over 600,000 doses administered, and that is more than Peel and York Peel and York all put together. And I think there's one more municipality, but it's the highest by any stretch in the province, and we're looking to push that up and get to 1 million doses administered.
Are we still seeing some trouble, though, when it comes to vaccine hesitancy? As you mentioned, there are teams going out there. I know you launched a program in different languages and trying to encourage everyone to get the knowledge to be able to make the right decisions for them. Are we seeing trouble getting through to some people?
Well, I think the answer to that is yes. I mean, because, I guess if you compare it to what an expectation was that certainly I had, and I'm not a doctor, but I expected people would be sort of beating the door down, to get a vaccine. And I think there's a lot of people who want to have one. And I think there's been two reasons that may have stood in the way of that. One is the hesitancy that it's either caused by some of the publicity that's been out there or just by people, the unknown. And the second is, I think there's been a lot of confusion because we have so many different municipalities around the GTA all doing different things. So one day you hear about a mobile car drive-in clinic. Another day you hear about something at a hospital. The third day you hear about a certain group by a certain age. And I think that has confused people and made it more difficult. But look, we're doing much better. I mean, the more we've taken the age down and opened more clinics, the higher the percentages become of the appointments that are getting filled. So earlier this week it was in the 90s. I think it's still in the low 90s or high 80s now in terms of these clinics being occupied, and our objective is to keep it there and then to supplement that by taking more of these people out into the community that can actually go to the high-risk neighborhoods. We've taken the age down, substantially in order to get everybody in those high-risk neighborhoods, not just the essential workers and the adults, the older adults, as it were, but also some of the other family members who are a bit younger.
You're right. There's so much information out there. It can be confusing. I do encourage people to visit our website, which also links to the City of Toronto. So citynews.ca if you want to take a look
Definitely.
at all the information, which is constantly updating. So please do that. All right, 7:13 is our time right now. That does it for my time with you, Mayor Tory. Appreciate the weekly check-in as always.